On a Sunday morning in a quiet suburb, a husband and wife I'll call Tom and Linda sit down at their kitchen table with a pot of coffee, a calculator, and a stack of paperwork. And they are about to do something that almost no American married couple has ever actually done. They are going to try to answer a single question. If one of us needs long-term care, will this family financially survive? Tom is 67, Linda is 65, 2 grown kids, a house that's been paid off for almost a decade, a combined savings of just under $300,000. Both of them have Medicare. Linda's mother lived independently until she was 91. Tom's father worked until he was 73. They have done the things you're supposed to do. They feel responsible, cautious, prepared. By the time they finish their second cup of coffee, they will discover that almost every assumption they brought to that table is wrong, that Medicare does not cover what they think it covers, that their savings will not last as long as they think it will, that the house, the thing they always assumed was their backup, is not actually a backup at all in the way they imagined, and that there is one number, one specific dollar figure, that will quietly bankrupt families like theirs, and that almost no one in America is told until they're already standing in the middle of it. That is what this video is about. Because Tom and Linda are not careless people. They're not bad with money. They are just exactly like most American families, which is to say, they have planned for everything except the single most expensive thing that can actually happen to them. So here is my promise for the next 20 minutes. You will know the one assumption about Medicare that costs more American families more money than any other misunderstanding in this entire subject. You'll know exactly what long-term care actually costs in this country, in 2026, by the kind of care, and how dramatically those numbers swing from state to state. You'll watch Tom and Linda actually do the math for their family, and by the end, you'll know the 4 ways American families pay for this care, in plain English, in the order of how realistic each one is for normal people. And you'll have the worksheet in your head to do this math for your own parents this week. But first, the honesty I always owe you, because trust is the only thing that matters on a channel like this. Tom and Linda are composites, names changed, numbers grounded in real national medians, the situation drawn from many real American couples in their position. The figures I'm about to use come from the 2025 Cost of Care survey by CareScout, which is the most cited industry source on this subject, with results released in early 2026. These are national medians. Your state will be different. Your family will be different. I am not your financial advisor and I am not your elder law attorney. Treat what you're about to hear as the map. The professionals who run these numbers correctly for your specific family are a certified financial planner and a certified elder law attorney. I'll tell you when to bring them in. Okay, let's sit down at the table with Tom and Linda, and let me show you the first thing they get wrong. Tom opens a yellow legal pad, writes a number across the top, Linda's mom's monthly expenses if she ever needs more care, and underneath it, he writes the words, Medicare will cover. Because that's what almost every American assumes. We pay into Medicare our entire working lives. We're told it's our health care and retirement. So surely, when the day comes that mom needs full-time care, Medicare will pay for it. This is the single most expensive misunderstanding in all of American family finance. And here is the truth. Medicare does not pay for long-term care. It does not pay for a nursing home, except in one very specific, very limited situation. It does not pay for memory care. It does not pay for assisted living. It does not pay for a home health aide to help your mother bathe and dress every day for the rest of her life. Medicare covers medical care, doctors, hospitals, prescriptions, short-term rehabilitation, the kind of care that comes after a hospital stay when you're getting better. It is brilliantly designed for acute illness. It is, by design, not built for what happens when someone needs help with ordinary daily living, getting dressed, eating, bathing, remembering, for months or years. The one narrow exception is this. After a qualifying inpatient hospital stay of at least 3 days, Medicare will cover up to 100 days in a skilled nursing facility. The first 20 days, it pays in full. Days 21 through 100, you owe a daily copayment that runs into hundreds of dollars per day. And on day 101, Medicare's coverage ends, full stop, even if the person still needs full-time care. So that 100-day window is the entire Medicare contribution to long-term care in this country. After it closes, the family is on its own. Now sit with that for a second, because almost everything else in this video flows from it. Roughly 70% of Americans over 65 will need some kind of long-term care in their lifetime. Medicare doesn't cover almost any of it, which means the question every family eventually faces is the question Tom and Linda are about to face at their kitchen table. Who pays? So let's look at what they pay. Here are the numbers in 2026 from the most recent national survey of long-term care providers. A semi-private room, meaning shared, in a nursing home has a national median cost of about $315 a day. That is, in plain language, around $115,000 a year. A private room runs a national median closer to $130,000 a year. Memory care, the specialized kind of assisted living for people with dementia or Alzheimer's, typically runs 20 to 30% higher than standard assisted living, which puts the national median in the range of about $90,000 a year. Standard assisted living, which doesn't include the dementia specialty, has a national median around $74,000 a year. And in-home care, which is what most families try first, runs about $35 an hour for a non-medical caregiver. If you needed someone present for 44 hours a week, meaning weekdays only, that's roughly $80,000 a year. Around-the-clock in-home care, which is what real dementia care often eventually requires, can easily run double that or more. So put the rough national numbers in your head. $90,000 a year for memory care, around $115,000 a year for nursing home care, $75,000 a year for assisted living. These are the numbers nobody wants to look at, because once you look at them, you have to start doing math. Now here's the part that catches families off guard. Those are national medians. The state variation is enormous. In the lowest cost states, places like Louisiana, Mississippi, Texas, full nursing home care can run closer to $70,000 or $80,000 a year. In the highest cost states, Alaska, Massachusetts, the Northeast generally, Hawaii, the same care can be double or triple that. Alaska's nursing home median is north of $300,000 a year. The same family with the same needs can face a 4 times difference in the bill based purely on where mom happens to live. So when you're doing this math for your own family, the national median is a starting place. The number that actually matters is the one in your state, in your city, in the kind of facility your parent would actually go to. Okay, Tom and Linda are still at the kitchen table, and now they're going to do the math on Linda's mother, whose name in their family is Eleanor. Linda writes Eleanor's monthly income on the legal pad. Social Security, about $2,200 a month. A small pension from her years as a school librarian, about $800 a month. So Eleanor's income, before any care is needed, is $3,000 a month, or $36,000 a year. Modest, but enough to live on, because her house has been paid off for 20 years, and her expenses are low. Tom writes the next number. Memory care, in their region, runs about $7,500 a month for a decent place. That's $90,000 a year. And Linda goes very still because she's already done the subtraction in her head. Mom's income covers $36,000 of it. The gap is $54,000 a year, every year, coming out of Eleanor's savings. Tom and Linda know roughly what Eleanor's savings look like because Eleanor has always been open about it. About $280,000 in retirement accounts and savings. Tom does the division on the calculator. $280,000 divided by $54,000 a year. 5 years and 2 months. That's how long Eleanor's savings will last before the money runs out if she enters memory care this year. And then they remember a number that turns the whole picture darker. The average length of stay in long-term care, according to industry data, is about 3 years. But for dementia, for Alzheimer's specifically, the disease commonly runs 8 to 10 years from diagnosis. The average memory care resident stays in care longer than the average nursing home resident. So Eleanor's savings might last 5 years. Her need for care might last longer than that, maybe much longer, which means somewhere in year 5 or 6, the savings end and Eleanor is suddenly a person with $90,000 of yearly bills, $3,000 of monthly income, and no cushion. And then Tom and Linda think about the house. because everyone's instinct at this point in the math is to say, well, there's still the house. Eleanor's house is worth about $350,000. That's another 6 years of memory care, sitting right there in real estate, right? It's more complicated than that. The first complication is that Eleanor is alive and presumably wants somewhere to live. Selling the house while she's in memory care means losing the home she still considers home, with whatever emotional and practical effects that has. The second complication is that if Eleanor were married and her healthy spouse still lived in that house, selling it would mean displacing him. Tom and Linda happen not to have that problem because Eleanor is widowed, but for most American couples, the house can't be touched while the healthy spouse is still living in it. The third complication is that even if the house is sold, the proceeds become assets, which counts against any future application for Medicaid help with the bill, which means if Eleanor sells the house to pay for care and then runs out of those proceeds anyway, the family is right back where they started just a few years later. And if she keeps the house and eventually qualifies for Medicaid, the state has a claim against the house after her death through something called estate recovery, which we made a whole separate video about. So the house is not actually the backup most families think it is. The house is a complicated, slow, partial cushion that may or may not be available depending on a series of choices nobody likes making. I want to stop here because I want to talk to one specific person watching. If your parent is healthy right now, if no one in your family is in care, if the diagnosis hasn't come, if you are watching this with time still on your side, please understand what you have. Tom and Linda are doing this math because the diagnosis already came. They are not running this scenario for fun. They are running it because the question is now real. The version of this conversation you can have today while your parent is well is the version that gives a family options. The version Tom and Linda are having is the version that's left after the options ran out. So please write the numbers down for your own family this week, even rough estimates, even guesses. The single greatest predictor of which families survive the cost of care intact is not how much money they had. It's how early they did this math. Okay? So what do families actually do when they sit with these numbers? There are essentially 4 sources of money that pay for long-term care in this country, and I'm going to walk you through them in the order of how realistic each one tends to be. The first source is personal savings, what we've just walked through. It's how most American families pay, at least at the start. Retirement accounts, brokerage accounts, the sale of a home if it comes to that. The advantage is simplicity. It's your money, you can spend it on what you choose. The disadvantage is that the numbers we just walked through eat through it faster than most families expect. For Tom and Linda's Eleanor, savings cover roughly 5 years. That's true for a lot of families, so personal savings is the on-ramp, not the destination. The second source is long-term care insurance, and here's where most families have a painful realization. Long-term care insurance is a separate product, sold separately from regular health insurance, that pays a daily or monthly benefit toward long-term care costs when you need them. If your parents bought a policy in their 50s or early 60s, when premiums were lower and underwriting was easier, it can be a meaningful piece of the puzzle, covering, say, $150 to $200 a day toward the bill, which can stretch savings significantly. The painful part is this. Long-term care insurance is generally only available to people who don't yet need long-term care. Once a diagnosis like dementia is on the medical chart, the door usually closes. So this is the option that is either already in place, in which case you should know about it, find the policy, and start the claim process the moment care begins, or it is no longer an option at all. Either way, the first step is to find out what your parent actually has. Most adult children have no idea, because policies are often quietly bought and quietly forgotten. The folder is in the safe somewhere. The third source is the one most Americans don't realize they might already be entitled to, and it's called VA aid and attendance. This is a benefit from the Department of Veterans Affairs that pays a monthly stipend, meaningful, though not huge, often a few $1,000s a month, to qualifying wartime veterans and their surviving spouses who need help with daily living and meet specific income and asset limits. If your parents served during a qualifying wartime period, even for a short stretch, even if they were never deployed, this benefit may be available, and many families never apply for it because they never knew it existed. It's one of the most underclaimed benefits in this whole space. It will not cover the entire bill. It can cover a meaningful slice of it every month for years. We'll do a whole video on this one. And the fourth source is Medicaid. Medicaid, separate program from Medicare, despite the confusing name, is the main public payer for long-term nursing home care in this country. It pays for the majority of nursing home residents, in fact. But to qualify, your parent has to have very limited income and assets, which is the entire mechanism that creates the famous 5-year look-back rule we made our first video about. The path most American families end up on eventually is this: pay out of savings until you've spent down to Medicaid eligibility, and then Medicaid takes over the long-term care bill. It is not a glamorous path. It is not what anyone planned, but it is, statistically, what happens to a large fraction of American families who need long-term care, and it is okay. Medicaid is not a failure. It is a backstop. Knowing it exists, knowing what triggers eligibility, knowing what to do 5 years in advance to protect what can be protected, that is what makes the difference between a family that gets crushed and a family that lands softly. So that's the picture. Personal savings as the on-ramp. Long-term care insurance if your parent had the foresight or luck to buy one. VA aid and attendance if your parent or grandparent served. And Medicaid as the eventual backstop. Most American families end up using some combination of all four. The earlier you understand which combination is yours, the better every single decision in the next 10 years becomes. Here's the action plan, and it's just 5 things. First, this week, find out exactly what your parents' monthly income is. Social Security, pensions, any rental income, any annuity payments, the number on one piece of paper. Most adult children have a vague sense of this and not the actual figure. Second, find out the rough value of their savings, not the exact statements. They don't have to show you the dollars, just the order of magnitude. 5,000, 50,000, 500,000. The order of magnitude alone changes what you plan for. Third, look up the actual cost of memory care, assisted living, and a nursing home in the specific city or county where your parent lives. National medians are a starting point. Your local number is what matters. CareScout's cost of care tool lets you look it up for free by zip code. Fourth, do the math. Income minus monthly care cost equals the gap. Savings divided by the gap equals the years of cushion. Compare that to the realistic length of care your family is planning around. 3 years for nursing home, often longer for dementia. That single calculation, on a piece of paper, is the most useful thing you can do for your parents this month. And fifth, find out what's already in place. Is there a long-term care insurance policy somewhere in a folder? Did your dad serve during a wartime period? Are your parents' assets structured in a way that would qualify or fail to qualify for Medicaid 5 years from now? The answers to these questions don't have to be alarming. They just have to be known. Here's the reframe to carry out of all this. The families who get destroyed financially by long-term care are not the ones with the worst luck. They're the ones who assumed Medicare covered it and didn't find out otherwise until the bill arrived. The families who survive it, and there are many, are the ones who looked at the actual numbers 10 years early and built around them. The numbers themselves are scary. The plan, once you have one, is not. The difference between the two is one Sunday morning at a kitchen table. So if you remember one thing from everything we've covered, let it be this. Medicare does not pay for long-term care. Long-term care costs on the national median somewhere between $75,000 and $115,000 a year. The only families that come through it intact are the ones who did the math early. There is no version of being prepared that doesn't start with knowing the actual numbers. You now know them. If your family has been through some version of Tom and Linda's Sunday morning walk, the math, the discovery, the gap, please tell me about it in the comments. There is somebody scrolling tonight whose parents are healthy and whose math is still hypothetical. And your story is the thing that gets them to write it down this weekend instead of pretending the question can wait. And here's where we go next. The math we just did assumed the choice was nursing home or nothing. But here's the truth most families never learn. The menu is bigger than that, And there's a category of care that costs roughly half what a nursing home does, that works for the majority of older adults, and that almost no one chooses because almost no one knows it's an option. There's a way to get round-the-clock care for less than you'd think, and the families who find it stretch their savings dramatically further. That's the next video. If the numbers we just walked through scared you a little, watch the next one tonight, because it's the one that puts some of those numbers back in your favor.